For centuries, medicine has been one of the most uh, profoundly knowledge-driven enterprises we've ever come up with. You think about it. Every single diagnosis, every treatment plan, it all rests on this mountain of data, anatomy, physiology, pharmacology. But here's the kicker. That mountain has gotten so high, so incredibly fast, that we've hit the cognitive limits of what a single human brain can actually manage.
That is the absolute central point, and it's something Dr. Jiajie Zhang, who's the dean at the McWilliams School of Biomedical Informatics at UT Health Houston, really nails in his work. It was published in BMJ Evidence-Based Medicine. He's not saying doctors are going to be replaced. Not at all. He's laying out a blueprint for what he calls the AI-augmented generalist.
Okay, so that's our mission for this deep dive. We're going to get into Dr. Zhang's vision. We want to understand how artificial intelligence is becoming this knowledge unifier, the thing that bridges all these separate specialties, and what that means for medical education, which sounds like it needs a complete overhaul.
It does. And what's so fascinating here is that AI isn't just a passive database anymore, like an electronic textbook. It's becoming an active cognitive collaborator. It can reason, it can generate insights across domains that were, well, completely walled off from each other by specialization. It's kind of forcing medicine to become whole again.
Okay, so let's unpack that. How did we get here? I mean, specialization happened for very good reasons, right? How did that very success lead us to this crisis point where we now need reintegration?
It was a pretty inevitable historical path, really. You had the Industrial Revolution, which started to formalize medicine, standard curricula, hospital training, and that worked. It worked fine when the body of knowledge was, manageable.
But then the 20th century happened, and the sheer volume of that knowledge just went absolutely nuclear.
Precisely. You had breakthroughs in microbiology, pharmacology, and especially medical imaging. It was exponential growth. The human mind just couldn't keep up. And then the 21st century comes along and adds even more complexity. Electronic health records, the genomics explosion. Every single new piece of data, as vital as it is, just pushed the cognitive capacity of practitioners further and further into the red.
So specialization wasn't really a preference, it was a necessity. If you can't master everything, you have to focus on one tiny piece of it. And that gave us incredible precision in care, yes, but at what cost to the whole system?
The cost was fragmentation, system-wide fragmentation. And if you, the listener, have ever tried to navigate the healthcare system with some kind of complex multi-system condition, you've felt this.
Oh, absolutely. The frustration's immense.
Exactly. Patients face months of delays, of communication barriers. The cardiologist has one piece of the puzzle, the endocrinologist has another, the rheumatologist has a third, but the sister itself, it struggles to put those pieces together in real time. The whole thing starts to look less like a collaborative team and more like a collection of siloed empires.
So if fragmentation is the disease, as you put it, what is Dr. Zhang proposing as the cure?
He calls it medicine reintegrated, and the agent of that cure is AI. AI is the ultimate knowledge unifier. It's really the only thing capable of integrating the vast, disparate knowledge of every specialty and subspecialty, from oncology to geriatrics, all into a single unified system. It's an information management task that is, well, it's literally impossible for a single human mind.
And by doing that, AI lets the physician go back to being that integrated generalist. But we need to be clear, this isn't the old family doctor with a few textbooks and a good memory. This is something new.
Totally different. The AI-augmented generalist operates in what the source calls a distributed cognition framework. And that is a critical concept to grasp. It means the human brain is no longer the sole hard drive for all medical knowledge.
It's offloaded that job to the machine.
Exactly. The physician's expertise is then combined with AI's massive knowledge base and its reasoning abilities. They form a single, incredibly intelligent decision-making unit.
So the human becomes more of a manager and an adapter of insight, rather than just a collector of raw data. What's the biggest promise of that partnership?
It's the ability to just completely mitigate the fragmentation problem. This promises timely, highly accurate diagnoses. It promises a huge reduction in misdiagnoses. And it accelerates care by just collapsing all those referral barriers we talked about. You move from a system of sequential handoffs to a simultaneous integrated one.
This is where it gets really interesting because the source gives us a case study that makes this so tangible. Okay, so picture this. A patient walks into a clinic. They have this frustrating, really complex mix of symptoms: persistent fatigue, shortness of breath, swollen joints, and unexplained weight loss.
Right. In today's traditional fragmented system, that patient is about to go on a diagnostic odyssey.
A long one.
A very long one. They could spend 4 to 6 months bouncing between a cardiologist for the breathing, then a rheumatologist for the joint pain, maybe an endocrinologist for the metabolic issues. Every visit costs time, money, emotional energy, and each specialist is only seeing their little corner of the patient's health.
But in the AI-augmented scenario, the generalist pulls out their tools right away. The AI system can instantly access and cross-reference knowledge from all of those specialties at once. It's looking for patterns connecting, say, autoimmune inflammation with cardiac dysfunction markers and metabolic abnormalities.
And that immediate integrated insight lets the physician diagnose something like systemic lupus or a related disorder holistically, and much faster. We're talking weeks instead of months.
Wow.
The drop in unnecessary referrals, the elimination of delayed treatment, it dramatically improves patient outcomes.
Yeah.
Not to mention the cost and time savings for the entire system.
This shift in the doctor's role from being the synthesizer to being a collaborator, it obviously means medical education has to change. Fundamentally, we can't keep teaching medicine like memorization is still the main bottleneck.
We can't. If AI is now our active cognitive collaborator, one that can reason and generate insights, then curricula have to pivot. They have to move away from just rote knowledge acquisition. The focus has to be on understanding, applying, and skillfully using knowledge in tandem with these systems.
Well, wait, that raises a pretty big challenge, doesn't it? If doctors aren't memorizing all this knowledge, how do they know when the AI is wrong? How do they build that clinical intuition?
That's the core tension. And it's exactly why the human role is still so critical. Intuition in this new world comes from recognizing patterns and understanding mechanisms, not just simple recall. Dr. Zhang actually outlines 4 new essential competencies that physicians will have to acquire.
Okay, let's go through them. What are these 4 new competencies?
The first is AI system proficiency. This means the physician has to really deeply understand how these AI tools work.
Not just how to click the button.
Exactly.
Got it.
It's about understanding the underlying algorithms, the limitations of the training data, the uncertainty in the output. You have to know when to trust the machine, but maybe more importantly, when to question it.
That seems vital. I mean, if the AI was trained mostly on data from one demographic, its advice might be useless or even harmful for a patient from a different background. A human doctor has to be able to spot that kind of bias. Okay, what's the second one?
Second is collaborative problem solving. This is the practical skill. Integrating the AI-generated insights into your actual clinical decisions. It's about structuring your workflow around this partnership, figuring out when human data like empathy or a patient's story needs to override or at least contextualize what the machine is telling you.
And the third one, that sounds like it's all about the individual patient experience.
It is. It's called contextual adaptation. Look, AI gives you generalized insights from huge population data sets, but medicine is delivered one patient at a time. The doctor has to be able to tailor those general recommendations to the specific nuances of an individual. Their genetics, sure, but also their socioeconomic status, their ability to stick to a plan, their personal values.
Right. So the AI might recommend some expensive multi-stage treatment that's clinically perfect. But the physician knows the patient lives hours from a clinic and has limited funds. The physician has to adapt that perfect insight to what's actually practical.
Precisely. That is the irreplaceable human value in this whole framework. And the final competency, which sort of governs everything else, is robust ethical reasoning. This is about ensuring the responsible, patient-centered use of these incredibly powerful and often opaque AI tools.
Speaking of opaque, we have to talk about the risks. Medical training has to address these challenges head-on, because this tech is not infallible. We can't just assume the AI is always right.
Absolutely not. Training must equip physicians to handle very specific flaws. First, they have to be able to identify and mitigate biases from non-representative data. If your AI is built on historical data that systematically underdiagnosed a condition in women, for example, the new system will just amplify that historical inequity.
And then you have the whole black box problem, the transparency challenge. When an AI gives you an answer but can't really provide a clear, human-readable reason why,
physicians have to understand the limits of that explainability. If an AI spits out a critical, unexpected diagnosis, the doctor needs enough underlying knowledge to challenge that black box, to ask for the supporting evidence, and not just accept the result on faith. It's essential for maintaining professional accountability.
And finally, the big one in medicine, privacy and security. The amount of sensitive patient data these systems will be processing is just massive.
It's non-negotiable. Curriculum has to tackle these privacy and security concerns. Specifically, how do you securely handle patient data when it's being fed into large language models or these huge integrated databases? Doctors need to be trained on strategies for compliance and security in a world that's becoming more and more data fluid.
And beyond the clinical side, there's this whole complex regulatory and legal landscape. I mean, if the AI is an active cognitive collaborator and there's a diagnostic error, who's liable? Where does the buck stop?
That is the multi-million-dollar question, isn't it? Doctors will need to be trained on frameworks like EPA, GDPR, the new European AI Act, but more critically, the profession as a whole needs to clarify the legal and liability issues. Training has to clearly define accountability. Is the doctor responsible for vetting every output, or does some of that shift to the developer if the error was purely technical? We need answers before these systems are everywhere.
So what does this all mean for you, the listener, as we kind of pull Dr. Zhang's core message together?
It means we are watching a profound evolution in real time. Medicine is shifting. It's moving away from being an enterprise focused on knowledge acquisition through memorization to one that's focused on building the skills for effective, ethical, and responsible human-AI collaboration. A physician's unique value is shifting from what they can recall to how skillfully they can manage and adapt knowledge in partnership with a machine.
So it's clear the future isn't about human versus machine. It's about a fundamentally new type of teamwork in the clinic.
Indeed. We're looking at the blueprint for the next generation of healthcare professionals. They'll have to function right at that nexus of technology and compassion. The question isn't whether AI can master knowledge. We know it can. The real question for the next generation of physicians and for all of us is this. When knowledge is automated, what is the irreducible, irreplaceable value of the human mind in the practice of medicine?
Thank you for sharing your sources with us for this deep dive. We hope this roadmap helps you navigate the rapid changes in medical practice globally.